All right, I wanted to quickly discuss intracranial regulation, specifically head injuries. This topic might come up in advanced med surg course or possibly even an intermediate course, depending on how far you guys go with your professor. So just a few things that I wanted to show you guys how I learned it, because some of the questions you'll find, and especially NCLEX style questions, they're all the scenario will be very similar to any one of these abnormalities, and it would be very hard to distinguish between the few if you don't know the signs and symptoms well enough. And I used to just write them down just like this on a scratch sheet of paper. That way, as I'm sifting through the neurological questions, I can quickly distinguish which abnormality the question is pertaining to. So if you don't already know what Cushing's triad is, autonomic dysreflexia, and neurogenic shock, I would suggest you look that up and figure out what all of the signs and symptoms are for those and how to treat them and what to look for, because this video is just a quick tip. It's not in any way the full conclusive description of the abnormality. So I highly suggest you guys go look that up after this video or whenever you guys can. But this is how I remembered them. So for Cushing's triad, you have high blood pressure, bradycardia, widening pulse pressure, and Cheyne-Stokes. For autonomic dysreflexia, you also have high blood pressure, also have low heart rate. You have headaches, restlessness, flushing of the skin, diaphoresis, and nausea. Then for neurogenic shock, you have hypotension, and as well as bradycardia. Your skin's going to be warm, you're going to be dry, you're going to have dependent edema in your extremities. So sometimes these questions are written in a way where you're thinking it's one of these, but it's actually going to be something else, because there's a minor detail that you may have skimmed over in the timed exam. I highly suggest you write this down, and even if you don't have a scratch sheet of paper, before your neurological exam, go over this, write this down on a few times on a blank sheet of paper. This is how I learned it. This is how I would memorize all the signs and symptoms, and it helped me greatly. So the only thing that all three of these abnormalities share is the bradycardia. They all the patients who will have any of these will share the same bradycardia, but it's up to you to remember which one has hypotension and which one has hypertension. If you can figure out mainly these two, you can kind of narrow down the rest of the signs and symptoms. But again, you have to absolutely know what these abnormalities consist of, what signs and symptoms to look for, how to treat them, and what kind of injuries or mechanisms of injuries would lead to something like this. So I hope that helps.